If you are still troubled by your feelings, you may want to seek professional help. This may help you to be more comfortable with your feelings and provide useful suggestions for living with or changing them. Psychologists, counselors, social workers, and various health professionals can be helpful in this regard. Again, your local community resources like the Alzheimer's Association, health agencies, and the listings in the phone book can enable you to locate these people. Feelings do influence how you behave and vice versa. If you learn better ways to cope with these feelings, you will take better care of the patient and yourself. Similarly, learning ways to deal with patient behaviors that trouble you will help you to feel better about yourself and your patient. For example, you can learn more about managing difficult behaviors by watching and learning the material presented in this video series, or by talking with others about acquiring skills for managing these behaviors. Here are a few suggestions for coping with the uncomfortable feelings that can arise as you take care of your patient. If you are feeling depressed, make an effort to increase pleasant activities in your life. Give yourself things to look forward to. Learning more about the disease and increasing your level of skill in caregiving can also help you be more comfortable and less depressed. If you are feeling grief and sadness, it is also a good idea to increase pleasant activities in your life. Do some special things you used to do and have enjoyed in the past. Make time to do pleasant things. Also, talk to others who understand what you are facing. This may be in a support group or among other contacts you have in the community. This is a good strategy for dealing with embarrassment, shame, and guilt as well. Don't keep your feelings inside. Others experienced with caring for dementia patients will understand your feelings and provide support. Disappointment may result from having unrealistic expectations for the patient or the situation. Try to remain flexible and not expect things to go just the way you think they should. If you can suspend your expectations, you will not set yourself up for disappointment. Alleviate fear and anxiety by taking concrete steps, finding information, and planning for the future. For example, if you are a family member worried about having a valid will and making financial decisions, seek professional advice. If you are a paid caregiver worried about how to control the patient's outbursts in the future, ask an expert, find a class, or read some articles on how to manage that behavior. Solve problems and plan for the future to help reduce anxiety now. Anger may be reduced for family caregivers by using respite care to get away from the situation for a while. This allows a cooling off time for the caregiver. For both professional and non-professional caregivers, taking time out when things are not going well and trying again later is another way of letting anger pass before the situation becomes explosive. You cannot wish strong feelings away, so you must learn to cope with them by using a support system, admitting your needs and limitations, and reaching out to others for help. This is important for all caregivers. Who usually assumes the role of family caregiver? Most often, major responsibility for day-to-day care is assumed by just one person. It has been estimated that 3/4 of all caregivers are female, and most often family members. Typically, they are the wives, daughters, or daughters-in-law of the demented person. The largest number of caregivers are wives, who are most similar in age to the patient and can have chronic health problems of their own that make caregiving difficult. Younger caregivers, usually daughters or daughters-in-law, are often referred to as the sandwich generation because they have responsibilities to both the elder demented patient, the older generation, and their own children and family, the younger generation. Thus, they are sandwiched between the demands for their time and energy between these two generations. Most of these women work outside the home as well. Who are the paid caregivers? Most often, they are women, although there are also men who work in this field, but not nearly as many. Paid caregivers may work as in-home aides or nursing home staff. Sometimes they may feel that their job is thankless. Indeed, they often earn minimal pay and spend long hours caring for a patient who will not be getting better. They may have a hectic schedule with many patients to care for, and after a hard day on the job, they may feel too tired to pay attention to their own families. They may also sometimes feel criticized by family members or employers over how they spend their time or how they provide care. Changes in patient functioning will mean changes in caregiving. The level of care required to maintain the demented person is an important gauge of how difficult caregiving will be. Planning for care needs early in the course of the disease includes making decisions and arrangements for legal and health care problems that may arise. Discussing the patient's legal, financial, and health care preferences is very important and helpful in setting up legal documents such as wills and powers of attorney. If health care and financial decisions are made while the patient is still legally competent, you may include the patient in the decision-making process. This will help you be sure of making decisions that follow the patient's wishes during health care emergencies, planning for long-term care and financial security. Later, health care professionals working with the patient must be told what these wishes are and how to follow them. For many caregivers, this is a new area where they have little or no experience. They may feel intimidated by the forms and the serious decisions they must make on behalf of themselves and the demented person. Often, other care providers can help in this regard, sharing their own experiences and helping to identify resources. An attorney experienced in family issues surrounding dementia will know what steps are necessary to take and what documents are needed to cover future developments. Similarly, documents to specify who can make health care decisions for the patient, made in advance of any health care crisis, are also helpful. These documents will specify the financial and health care preferences of the person with dementia. If these sorts of decisions are made before a crisis arises, time and aggravation for all concerned can be averted. If you are a paid caregiver, you may find family members asking you for information on what you know about legal and financial matters. Find out some of the names of groups or professionals in your area that can answer such questions. That way, you can be a resource as well. As was mentioned in the beginning of this video, caring for a person with dementia is never easy, so it is important to reach out for resources within your community and family for help in caregiving. Using all of the resources available will help caregivers avoid exhaustion and isolation. Still, many caregivers try to go it alone, to provide all of the care without asking or receiving help from anyone else. Perhaps they feel that caring is their own problem and that they don't want to impose on anyone else. They may feel they have no one to whom they can turn for help, or they may feel no one else will understand this devastating disease. Some people feel that asking for or even considering outside help is a sign of weakness. All of these ideas, while certainly understandable, lead to feelings of overburden and isolation. A caregiver, whether paid or not, who is exhausted, depressed, and isolated cannot provide the best care, so both the demented person and the caregiver suffer. Asking for help is not a sign of weakness. As we said before, it's smart caregiving. The best way to care for a patient is to care for yourself. Try to set up a network of helpers. Reach into the family and the community for support. For example, respite care can be very helpful. Respite provides you, the caregiver, with time away from the patient. It can allow you to take a needed break from your responsibilities. Many caregivers find it difficult to take a break, even if they have someone they trust to care for the demented person. They may feel that it isn't fair that they go off and relax or have fun when the demented person is suffering. It is important for caregivers to take care of themselves. A break from caregiving allows you to refresh yourself, to keep life in better perspective. This will help you remain mentally and physically healthy and therefore provide better care to the demented person. Where can the caregiver find people to help with respite? There are a variety of types of help available. Once again, your local Alzheimer's Association chapter, social services, senior and aging services, and local hospitals or healthcare professionals may be able to help. Sometimes family, friends, and neighbors, church or community groups, agencies, privately hired aides, or sitters can help provide service. Sometimes a structured daycare program provides activity for the patient while allowing the caregiver to take a break. Other types of help that may be useful to the family are services which provide transportation for the patient, or those that provide help with meals or chores around the house. If you are a healthcare worker, perhaps hired by the family to help with care, you may notice the family may feel guilty or fearful about hiring or using help. Try to make them feel that they are doing the right thing for their patient by taking advantage of resources which allow them to take good care of themselves and the patient. No matter how hard the caregiver and family try to maintain a person at home, sometimes it just is not possible. If it is no longer possible to provide the level of care to keep the patient safe and healthy, it will become necessary and desirable to place the demented person in a nursing home in order to ensure the best possible care. This is often an emotionally charged and difficult decision for the family or caregiver to make. Sometimes the caregiver is criticized by others. Unfortunately, unthinking individuals sometimes cause additional emotional turmoil and pain to those who have made this difficult decision. Sometimes the demented person and the family have a hard time adjusting to nursing home placement. The demented person may complain or act out, lose weight, become depressed, and these behaviors may alarm the family. Family members may doubt whether they have made the right decision about placement, and any feelings of guilt they may have about placing the person may surface now. They may criticize staff for not taking proper care of their loved one. The best advice for both family and staff at this point is to try to carefully monitor the patient and encourage communication between staff and family. This may be an adjustment phase that merely needs time, or it may be that something is not right and needs to be corrected. If you are a family member, discuss your concerns about care or home rules with the staff at the home. Know what patient and family rights and responsibilities are. If you can, visit regularly, volunteer to help, and join family or advisory groups. If you are a staff member, be aware of how difficult the change from home to facility is. Patients, families, and staff must give the change a chance to work and must become more comfortable with each other. Caring for a dementia patient is never easy. but by reaching out to those around you, accepting help for day-to-day activities and problems, admitting caregiving abilities and limitations, making important legal and financial decisions before a crisis, and taking care of both physical and mental health, caregiving can be a manageable job. This tape has covered who becomes a caregiver, feelings caregivers have, how they can seek help for troubling feelings, practical concerns over legal and financial issues, encouragement and instruction on how to avoid isolation, and where to look for help in the community. We know these solutions sound easier than they are, but hope that we have given you some new ideas and new directions to follow that will make caregiving more manageable for you. We wish you the very best of luck in your caregiving.